So this is the Transformative Ecosystem Arena workshop or panel, connecting the dots in the health ecosystem. My name is Sanna Turnas. I'm from Tampere University, and I have been preparing this event much with my colleague Sophie, who's not able to be here today. But just before we start with the real topic, I will give you a short introduction of why we are here. So we are a part of the Transforming Health and Care Systems program, which is a broad program, and you already heard about this this morning. But it's maybe good to always have a little bit repetition if somebody missed that. It's a broad program with different types of organizations, ministries, funding organizations, and also research institutes that I also present myself. In a nutshell, Transforming Health and Care Systems program is a Horizon Europe co-fund action, and the aim, also very much in a nutshell, is to create a sustainable, efficient, innovative, and people-centered health and care systems. And that's also, I think, what our ecosystems are about. So how? It's about coordinated research, innovation, capacity building, and research and innovation project funding, but also stakeholder engagement. And then, again, moving more and more towards the ecosystem part, there is one work package dedicated to fostering health and care ecosystems. Our Austrian Research Promotion Agency and the lead of the work package, Gerda Geyer, is also present here. And what Tampere University is responsible for is specifically work related to transformative ecosystems that often take place on the regional level. With our partners, we've been detecting, analyzing, and now also promoting these transformative ecosystems. And what we, for instance, been doing is gathering a kind of a case catalog of different types of health and care ecosystems across Europe. And then we move again forward to our topic of the day. We've been analyzing these different ecosystems and trying to understand what makes these ecosystems transformative. And we've been building a framework of, we call them beacon transformative elements, ecosystems that we consider that are transformative are often, first of all, sustainable models. So it's more about long-term collaboration instead of like short project cycles. There is a strategic alignment, so there are, as we also heard today, so in the ecosystems that are transformative, there are shared goals and coordinated implementation. Users have been integrated, which is of course very important, but also that there is some recognized impacts. There may be awards or reference sites statuses, but most importantly that there are coordinated outcome measures and that they are also visible some way. And then that leads us to our ecosystem presentations. So we have two ecosystems that were recognized under also many other very interesting ones, but that really showed transformative elements. So now I welcome Pauline Terwijn from the board of Mooi Maasvallei Network and Riccardo Farina, Department of Health and Social Policies from Trento, presenting the Trentino Salute 4.0 ecosystem. And due to some weather conditions yesterday, we are unfortunately not able to have Pauline and Vanessa, our Dutch colleagues representing the Mooi Maasvallei ecosystems here on site. But luckily, technology works, hopefully also, and we are able to still hear about their model. And as for the structure of the event, we will hear the presentations, some around 10 minutes. Then you will have an opportunity to ask questions and comments. So if you want to note down something, there are pens and paper in your tables. And then we move forward to to the Trento ecosystem, and the same goes again. So there will be time dedicated for questions and answer. And after this first part, for the first 45 minutes, then we will also have a panel, which is kind of the part 2 of the Transformative Ecosystem Arena, with a little bit broader network reflecting these 2 ecosystems and their meaning. But now, without further ado, I very heartfeltly welcome Pauline Terwijn, the board of the Mooi Maasvallei network, to give a presentation.
Well, thank you so much, Sanna. Good afternoon, everybody. Together with Vanessa, you see her also on the screen. We are very delighted that we can tell you more about our goal we have in our region. And unfortunately, we're not present in at your place, but luckily we can do it on this way. So we have some sheets we will show you now, and then I will tell you in 10 minutes more about what we are doing in the region in Holland. It's a region that is in the south of Holland, and we call it Mooi Maasvallei because the Meuse is there as a river, and it's very beautiful. So we say in Holland Mooi Maasvallei, and in English it's beautiful Meuse Valley. It's a region for 130,000 inhabitants, and we are collaborating in working together for more than 10 years. And our vision is that only if you work together with all the parties in the region, you can do something for your inhabitants. We think that you only can help them by living vital, living healthy. You have to work together. So if you are a healthcare professional or a municipality employer, or you are working in the region, or you're maybe a school member, everybody has to think, what can I do to help the inhabitants to live their life well? You see it here. We think of the inhabitants from when they are born till that they are very old. And we do that together with the professionals. And that's how we build an ecosystem. And in those 10 years, we have seen that the vision got more goals. And we have 3 of them. The first goal is, what can we do to help the inhabitants to stay healthy? What to do for prevention? How can we help them not to get ill? And the second goal we have is, if you have a question where professionals can help, we do that at home. So professionals collaborate at home for what an inhabitants need. And when it's necessary that somebody needs something on another spot, in hospital or elderly care or at the GP or in the municipality, then we have ways to use the capacity as good as we can. And one reason lately, the last years, that we like to act this way is that in the next 5 years, the healthcare will grow will double, but we don't get more professionals. So we have to collaborate more and more to give the care where it's necessary and who needs it. So I will show you in the next slide some outcomes of our system. And maybe before, I will first show you this and then say what you can do to reach this. We see now in 10 years that we spoke a lot together, we worked a lot together, that we see in the acute care that we have less 70 elderly on the ER, more than 12%. And that's not that there's less acute care. But what we see is that when a GP and an elderly specialist and elderly nurses, but also the home care works together, they can see on forehand if it gets an acute situation. And you can provide that. So that's one of the reasons we have 12% less on the ER. we have now the right time, the right care in the right time at home. And that's because of the regional coordination. We have one point in the whole region where we see which beds are open, which home care we can use. We know how many beds there are in the hospital. So when the GP is at home with an inhabitant and he knows, well, there's only one bed in the hospital for the next weekend, he can provide other care at home than using the bed if he doesn't know how many beds there are in the hospital. Well, we have the bundling of the home care and the well-being care. And we see now that if you see which capacity you have, not all the questions for home care are for the home nurses. We see that 25% of the question for home care can better be done by the well-being care. So that's very interesting. We recently find that out 2 months ago. And it's impressive when you see that you bring people together, professionals together, who are talking about what does the inhabitant want, that they say, well, that's my part, I can do that. Well, we placed in the vision of having more vitality at home, our geriatric specialists together with the GPs and the home care in the local situations. And it helps a lot for the GP and the nurses to have the geriatric specialists thinking with them what they can do the best. We build up precaution circles where inhabitants look at each other. So they have less questions at the GP or at the municipality. And we see now that there is less GP question in the region because of the precaution circles. And something totally different, for more than 12 years, we have the nutrition education for all the children between 9 and 12 years old. All the children goes 4 days in that period to a special place where they learn about vegetables, how to cook them. They look at the Big Mac from McDonald's. What's the bad part of it? They learn it from a dietist. So they learn more about healthy food. And you can imagine what questions that gives at home when they have had those lessons. On the next slide, we show you something of our principles, because the whole way of working really relies on trust of working together, trust in believing in one vision instead of your own vision of your own organization. And that's the part we started with more than 10 years ago. We have one vision that all organizations, healthcare, municipalities, the schools, all have the same vision. We have to do something to help the inhabitants. If they're young, if they're employer, if they're older, if they need care, everybody thinks of how can I help? And we start everything in the region at the same time. My really goal is that everybody is moving. So don't wait for each other. You can't organize it. It's not in your hands anymore. But the nice part is everybody knows what you want to reach. Then they will act in that way. So it's completely different than having an organization and being the boss of it. You have to realize it's a transformation. It's not a project. And the biggest challenge is to challenge yourself. What I tell you now, you can't organize it. You have to believe things and you have to give your employers the space to act in another way than they used to do. What we see in 10 years, 12 years, we build a new language together. The languages of all these organizations are different. And you have to tell each other what you need, how you are acting, what your professionals need, and they build together to a new sort of system. My part is see solutions for the dilemmas as a challenge. there are lots of dilemmas not to work on building an ecosystem. There's only one reason to do so, that you really believe this is the next step in the transformation. And the driving force you really want to connect to are the inhabitants. And they like it. When you make the connection with them, it's difficult. It's not in your system most of the time. You are busy enough. But when you ask the inhabitants what they need, that gives you the drive. But the main goal is your own perseverance is your driving force. Really, if you don't believe this, if you don't feel it, it doesn't work. It's also okay. But we like to build the ecosystem, and we have much more people in our region who really believes it and work on it. So this is the first step in telling you about our ecosystem, Mooi Maasvallei. Trust, prevention, and working together, that are the main goals we set for having more vitality for our inhabitants. So, thank you.
Thank you, Pauline. So now there is time for questions. Maybe, okay, Donna, I see, but you can start. Please, go ahead. Federico will bring you a mic.
Thank you. Pauline, that was really inspirational, so thank you so much for sharing that story. I had something that I wanted to ask you what you meant by it, and now I'm trying to read my own writing, which is not that great. But yeah, you spoke about... no, I cannot find it. It was on that last page, I think. Yeah, you spoke about, here it is, precaution circles. Can you just tell us a little bit more about that?
Were you able to hear that, Pauline? Yeah.
Yes, I heard it. The question is, what about the precaution circles? Thank you for asking me, because that needs more words than only mention it. A precaution circle is a sort of coming together for 30, 40, 50 inhabitants who live together in a logic way. They live together in an apartment building, or they live together in a small community. And one or two of them are the ones who started. And they ask all the inhabitants, well, how are you? Are there things you need, or how do you act when you're ill or you're not well? And because of that, they know, they look at each other. People can help each other. Sometimes by having a bulb, a new bulb in the lamp. Sometimes by having their garbage sitting outside when they can't walk for a reason. Sometimes by having rides to the hospital. But what you see is that they come together and they look for each other. They have more well-being. They are seen. They can be there. They're not alone in their house. So it's much more involvement together than only living on your own.
Thank you, Pauline. Other comments or questions? Yeah. So there first, and then in the middle. Yeah, just a moment. Okay, so there is many questions.
Thank you very much for the very nice presentation. I just wondered, could you say a few words about whose initiative was it to align the different activities, and what is the backbone of it? Because of course it also takes some organizational effort to keep different organizations and all the stakeholders aligned. Thank you.
Well, I think I can say that I started more or less when I came 10 years ago working in this region. I started by having meeting all the other CEOs in the region, in health, in the municipalities, but also in the schools. And because of meeting each other very oftenly, we started to build a vision. And it took some years to have it more smooth like we talk about it now. But everybody had the awareness, if we don't work together, well, we won't build more than we have now. So that was really important for them to realize. And after that, we talked about it a lot with all our professionals, and they said, well, if I can act more together with the other professionals from other organizations, it will help the inhabitants. And the nice part, if you are in a region, most of your employees are also inhabitant in the region. They have also children at the schools. They have also elderly living somewhere together. So it worked by having a lot of talking and belief that we had to do this together. The nice part is that when we build this up, we found out that structure didn't help us. So 2 years ago, I tried to build a structure by having a boss and a vice boss and who's responsible for the finance. And then we had a totally different communication. So I said, well, we stop this. We are equal. It doesn't matter if you have a big organization or a smaller organization. We do this together. And now we're working still in the same way. We're looking for a sort of governance who helps us to stay equal together and having the finance in a different way. But the main part is you have to believe in each other. You have to believe together in the goal. And well, luckily until now that works.
Yep. So there's time for 2 more questions. I think there was one, and did you say there? Because we also need to keep up a little bit the time. So please, yes.
Well, thank you for a very nice presentation, and also a reminder that the transformative ecosystems are driven by people. So, and you just reminded us that just putting them together is the first step. So I think that's a very good reminder. I'm Jane from Aalborg University Hospital. Geriatric specialists are a limited resource, I think, at most hospitals today. And I think it's very interesting that you put them close together with the primary sector and the GPs as a preventive initiative. How did you at all struggle with them being a limited resource in that matter, facing hospital tasks as well as being out together with the GPs? So, and how did you cope with that?
Were you able to get that?
Can you summarize it, Sanne, please? Because it was not. I was not really able to hear it very well.
You mentioned that you have placed geriatric specialists out with the GPs in the primary care and as a preventive effort. But here in Aalborg, at least, they are limited resource, and the geriatric specialists. Was that an issue for you as well? And if so, how did you cope with that?
Yeah, that's a very interesting question because the resources, we don't have other resources. So we do it with all the professionals we have. And what leads us is our vision that you have to place people, professionals, on the right spot where they can have the best results. And the best spot for a geriatric specialist is near the GP and the home care nurse, and not longer in the elderly care homes. Because people come much later in their life, only the last 5 months in Holland, in the elderly homes. So we have more of what they know in the region. There is no other payment for that. But we think this is the best to help to decrease the healthcare question in the next 5 years. All the questions about money, we have no answer. Our only answer is you have to start building an ecosystem, and luckily we hope the finance will follow. But maybe it takes some years more to have that finished.
And then final, hopefully a quick question.
Yeah, thank you for this inspiring work that you've done and shared with us. I'm Tara Kiran from Canada, and actually my question was going to be about funding. How did you fund some of this work and the initiatives to start? Some, I think, are just changing existing resources, but maybe some required new funding, even designing an education program for nutrition for children. How did you fund that work? And also fund, it sounds like you have some evaluation as well.
Yeah, we have no funding. So we do it because we do it with the professionals who are already working there. And we find some funding for the nutrition program for the youngsters through the municipalities, but every year we look again for some money. So we do it together, but it's really difficult to find money for it. But because of our belief, we manage it till now. Somewhere the financial system has to follow what we are doing. Otherwise, we can't bear this for 4 years. But luckily, we are in a program now in Holland where people are looking for other finance systems in a region. So hopefully we can be one of the first to have the tryout.
Yes, thank you, Pauline. I just have to say that we had a great opportunity to visit the Mooi Maasvallei network, and what we experienced, that everybody was saying the same thing. So they really shared the sense of urgency, and there was a really strong sense of trust. So you've been doing great work, Pauline, and we were even wondering if you already had this shared. That please tell this to the people who are visiting, but apparently this was not the case. But in any case, thank you so much, Pauline, for sharing your views on your ecosystem, and also thank you so much, everyone, for the questions. Let's give Pauline now and Vanessa an applause.
Thank you.
And now we will move forward to southern parts of Europe, to Trento. Please, Ricardo.
I can say there.
Where you want, if you want to have your PowerPoint there.
Yes. So, first of all, it is a great pleasure to be here today, especially after a challenging trip of about 18 hours. So, my personal challenge has been won. So, I would like to thank Tampere University for the kind invitation, and of course, Promise Network for always triggering collaboration among territories. So, to introduce the ecosystem, I represent that it's called Trentino Salute 4.0. Salute means health in the Italian language. I want to start from the territory. So we are in the northeast part of Italy, 500,000 inhabitants, more or less, 2 main cities in the main valley, and a lot of small and very small municipalities. One only healthcare trust, and a peculiarity that is our statute of autonomy. It comes from a long history among the 2 World Wars. If I have a couple of hours, I can tell you something. But anyway, this statute appoints to the province of Trento many duties and responsibilities that in other regions in Italy are up to the Italian government. And some key stages towards the creation of the ecosystem. So the first one was the provincial law on health. That is a provincial law up to the autonomy that, of the province. So among other issues, in the provincial law, that it was stressed a strong commitment in implementing and developing digital health. So 2010, I think that it was a great milestone. 1 year after, the action plan on digital health which start from exploring the context, European level, national level, and provincial level, and set some macro objectives and medium-term goals. And in 2015, the health plan of Trentino, which broadens the concept of health and well-being to encompassing also social, economic, and environmental determinants of health. 2016 was established the Competence Center of Digital Health, Trentino Salute 4.0. It was formally established with the provincial government act, and it is jointly managed by the province of Trento in the role of decision maker, the Healthcare Trust as the provider of services, and also FBK Fondazione Bruno Kessler as technology and research partner. Of course, as you will see in the picture that represents more or less the quadruple helix approach, the ecosystem is open to companies and citizens following a quadruple helix approach. It was awarded in the same year, 2016, from the European Innovation Partnership on active and healthy aging, and it is also a joint research unit from 2018. Which is the main outcome of this ecosystem? The main outcome is the unique gateway to access healthcare services in Trentino, which is called TreC+. TreC from its Italian name, TreC, Cartella Clinica Cittadino, that means more or less personal health record. So, as you can not see, since there are a lot of stuff, but anyway, it is an electronic health record with a lot of services, your referrals, pharmaceutical receipts, the possibility to change your general practitioner or pediatrician, the possibility to delegate others to access to the record, lots of empowerment services to citizens, so the possibility for the citizen to complement their data with other referrals or information or diaries, something like this. Another part of services of telemedicine, so specific services that can be prescribed by the specialist, and then you can find it on the app. So some chronic disease like diabetes or cardiology, something like this. And as you can see, it followed the citizen in his whole life course. So when he's a baby and up to the elderly. In this final slide, I try to provide you a different representation of the ecosystem. So there are 4 rows: the policy level, the research and innovation level, the services. The last level is users. I don't want to call it citizens, since otherwise it seems that it's something top-down approach, while the citizens are involved in all the processes. The user is just to provide some numbers. But anyway, starting from 2010 up to 2026, that it is more or less our deadline for all the National Recovery and Resilience Plan challenges. This is the whole representation. So the 3 key stages that I mentioned before, so the provincial law of health, the action plan, and the health plan. At the research and innovation level, there was continually going on co-creation, living lab with an user, chatbot, digital therapeutics, then telehealth services, then also artificial intelligence. When the research level is ready, we can deliver services to citizens. So in 2012, there was the first release of the platform. Then in 2016, for example, there was the first delivering of a specific app for diabetes. And then starting from 2021, there was the whole platform which encompassed all the services. After 1 year of the implementation, we had something like 30,000 users in the platform. And if you see the lower line, we grow very fast, especially during the pandemic outbreak, since the need to have a tool in your hand to manage all your stuff related to healthcare was really felt as important by the citizen. And now we have about 300,000 users among a population of 500, so 3 to 5. And also, I want to mention a specific app dedicated to pregnant women, which is TreC Mother, which has 5,000 users. If you consider that in Trentino there are more or less 3,500 childbirth in a year, it is a great result. In the first row, just to mention that Trentino Salute 4.0 was established in 2016, and it has 3 years cycles. So 2017, 2019, 2022, and so on. 3,000 cycles that are cycle to funding the center, but also to set some goals, to monitor and to supervise the activities. So I think that this short period are really important. That's it. Thank you very much.
Thank you so much, Ricardo. So now again, time for questions and comments. Maybe I can now start, since there was no immediate questions arising. We also had the pleasure to visit Trento, and what we really strongly experienced was the strong political level support for this. So what do you think was the role of this for all of that to happen, and what if things were differently?
Well, I think that the policy endorsement is really important to maybe to trigger the transformation. But after that, I think that the communication between the policy level and all the other stakeholders has to be bilateral. So it has not to become something that it is top-down, but something that engages the stakeholder and get their feedback. I was hit by the consideration in the previous panel of Carmen Santos. She said that not all the member states are ready to lose part of their sovereignty. No, talking about the European level. So you don't have to imagine that we are all kisses and hugs anytime we met together. So it is difficult to align the agendas of different entities, of the policy side, the healthcare trust, the research institute, the citizen. But this is the attempt. So the endorsement of the policy side can trigger something, and then people have to work on it.
Yeah, exactly. So any questions now arising? Okay, so I will go here first and then.
Thank you. So maybe a follow-up on the question that you just had. So how would you describe the process if there were conflicts or disagreements? So how were they resolved within the system? Was that by sort of escalating hierarchically, or was it sort of a consensus process where you would negotiate until you were in agreement across the different parties with different interests?
Well, the center has its own governance. So he has a steering committee that is upper level and a technical committee. And so there is a monitoring process to monitoring what's happened and trying to tackle with all the eventual conflict. So it is a continuous process, but no one of the bodies involved as the main voices on the table. It is something that is based on the relation from different bodies. So the governance, I think. Thank you.
Thank you, Riccardo. It was very inspirational what you told us. I was wondering, you mentioned in the beginning of your presentation that there is some kind of national electronic health record also in Italy, and you have now a system that works very well for the population in Trentino, which is about 500,000 persons. Did you see some appetite also from other regions in Italy to take over the system, or are other regions working with other systems? What is the view on scalability for your approach?
Yes, of course. Thank you for the question. It has already happened, I have to say, since Trentino province is mainly, I think, the first territory in Italy that developed an electronic health record that works well. So other regions can ask us for reusing something of this record, and also related to particular application, specific application for diseases or for moments of life since as a pregnancy. For example, we had a collaboration with an hospital in Rome to reuse our TreC Mamma, and it is particular that the challenge they see, the challenge we see to provide access to women in the valleys is more or less the same that the hospital in Rome sees to overcome the traffic disease to reach the hospital in Rome. So, you know, and also the number of births in that hospital are the whole of Trentino. So it's very particular how different challenge can be addressed with the same tool, but there is the possibility to reuse the application. And now, thanks to the National Recovery and Resilience Plan, all the regions are coming to a unique repository of referrals or something like this.
And then there was one more, we can have one more question, and then there is time.
Yes, thank you. So my name is Minna Fagerven and I'm from University of Helsinki. Really interesting, and I need to ask to what extent there were some data concerns by the citizens. So I can imagine that launching such an app and this kind of system also requires some kind of campaigning for people to take part. So were there any, and what kind of campaigns did you run?
Yes, this is a great topic. In our ecosystem, it is also the University of Trento, the Faculty of Law, can support us to privacy issues. And that is a topic. So citizens can decide who is allowed to see his or her referrals within the health record. So, but it is something that you can decide instantly. I can go to my electronic health record and decide I want to only my general practitioner or also a specialist. So the citizen is empowered to decide who is allowed to see his data. Another point is trust. Since even this morning, some of the speakers talk about trust. When you download something from Google, we did not have in mind what their data can go. But in the territory, when you has to decide if your own government or your own healthcare trust can access your data is something more tricky.
Okay, now I think it's time for a coffee break, but huge thanks also to Ricardo. I also felt very much in visiting your region that there was really like a sense of being proud of what you've been building together. And as said, there must be then some serious trust to make all of this happen. So thanks for everyone for all the questions, but maybe now we first say thanks to Ricardo.
Thanks, Julia. Thank you.